In this lesson, we'll begin our discussion of the spinal cord and the spinal nerves. Specifically, we're going to take a look at the three meninges and the three associated spaces. So, if we were doing dissection and we were going to take a look at the spinal cord, we would begin by taking a look at the bony protection. Now, we covered this already in other lessons when we had done the study of bone and the vertebrae, that type of thing. If you remember, the vertebral canal is the hole that houses the spinal cord, right? Anteriorly, it was bordered by the vertebral body. On the sides, laterally, it was bordered by the pedicles. And then in the back, posteriorly, it was bordered by the lamina. So we already discussed that, and like I said in previous lessons. What we want to look at now is once we cut the bone away, the next thing we would see would be the meninges. So we could think of the meninges as connective tissue coverings that surround both the spinal cord, which we're talking about in this lesson, but also the brain, which is going to be covered in future lessons. So there are three different types of meninges. The outermost meninge is known as the dura mater. Right? Dura means tough, and mater means protector, like the mother, right? The tough protector. This is the outermost layer. It's made up of a dense, irregular, fibrous connective tissue. So it's pretty tough. If you grabbed it with forceps, you wouldn't be able to rip it. You would have to actually cut it with a scalpel or with scissors. Now, the dura mater starts at the occiput, at the foramen magnum, and then it goes all the way down to the sacrum, and it goes to the second sacral segment, and it forms a sac, right? We actually call that the dural sac. Sometimes they say the thecal sac, right? For those of you going into X-ray radiology, right? This is something that you hear all the time. So let's take a quick look. So this is a cross section of one of the vertebral levels. So we can see anteriorly here, this is the vertebral body, right? The pedicle would be under here, the other pedicle would be under here, and then here's the lamina and the lamina. Okay, and then this would be the spinous process. And we can see in the vertebral foramen, this is where the spinal cord is right here. So the outermost layer is this tissue here that I have labeled. It's the dura mater. All of this, it goes all the way around, right? That's the dura mater. Now, there is a space, or actually two spaces that are associated with the dura. This space just outside the dura, I have it labeled here, and you can see it's filled with fat. Right? It's actually filled with fat and blood vessels. All in here is known as the epidural space. So we know that epi means above or upon, right? So it's just outside the dura mater. Right? And again, it's filled with fat. So that fat's going to act as a nice cushion, a bit of a protector. All right, so dura mater here, just outside it, epidural space. Now, just underneath the dura, that kind of black area right there, this is going to be the next space known as the subdural space. I labeled it right here, and I have it down over here also. Now, this space is technically a potential space. There should be nothing in that space. The dura mater and the arachnoid mater, which is the middle meninge, should actually be laying on top of one another like that with nothing in there. So I call it a potential space. However, sometimes with trauma, there's bleeding and inflammation in that space, and then it could fill with blood and inflammatory residue, transudate, that type of thing, and cause like a bit of a swelling. We sometimes call that a subdural hematoma. Right, so that would be under a traumatic event. Normally, again, this space should be totally empty. All right, so again, one more time, find the dura mater, go outside of it, epidural space, go underneath it, subdural space, right? Sub means below. Okay, so let's just make sure we got everything here. All right, so we have the epidural space and the subdural space. Okay, the middle meninge, right, the second meninge, is known as the arachnoid mater. So as I said here, it's the middle layer of meninges. It appears as a fish net or even a spider's web, hence the name arachnoid. This is a thinner layer of dura mater, and it's also made up of a fibrous connective tissue, but it also has some elastic components to it. So if we take a look here just one more time, right, this was the dura here. Right, so now the next meninge here, and it goes all the way around, is going to be the arachnoid mater. Now, just under the arachnoid, there's a big space here. You can see all of this. Right, it goes all the way around here. All of this kind of this blackish area right there. All of that is the subarachnoid space. So again, sub means below, below the arachnoid. Okay, and I have it labeled here for you. All of that is the subarachnoid space. Now, what's important about this space is that this space contains CSF, which stands for cerebrospinal fluid, right? Cerebrospinal fluid. And we're going to see there's a couple places in the nervous system that has cerebrospinal fluid. This is the first one that we're looking at. Right? So basically, our spinal cord and even brain is floating in water. All of this would be filled with water. Finally, guys, the innermost meninge is known as the pia mater. Pia means delicate, and again, mater means mother or protector, right? So this is the delicate protector. This is a much thinner. It's actually very, very clear. You can, kind of reminds me of saran wrap. You can look like right through it. So this is the innermost layer of meninge. It's right firmly adherent to the spinal cord. It's highly vascular. It's also made up of fibrous tissue, so it has some strength, but it has some elasticity also. So you can see right here, this meninge right on the spinal cord would be the pia mater right there. Now, I didn't label it here, but in your notes, if you go back a moment, you'll see the denticulate ligaments. These here, these white lines go across. These are extensions of the pia mater, right, just kind of going out laterally to help stabilize the spinal cord so the spinal cord doesn't shift around. Okay, so that concludes this lesson on the three meninges and the three spaces.